Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Neurological assessment. Neurological assessment can be done by electroencephalogram or evoked responses. 1. Electroencephalogram. In electroencephalogram, neurological assessment can be done by two ways. One, by activation of electroencephalogram, or by activation or by depression. In EEG, activation, that is high frequency and low amplitude, is seen. Okay, in EEG, activation waves are high frequency and low amplitude. Activation or increased EEG is seen when inhalational agents and intravenous agents are used in low doses. Increased or activation of EEG is seen in ketamine and nitrous oxide. It is also seen in early hypoxia, that is mild hypoxia and hypercarbia. Second, depression of EEG. Depression of EEG is low frequency and high amplitude. Depression of EEG is seen in inhalational agents or intravenous agents in high doses. Depression of EEG is also seen in opioids. It is also seen in late or severe hypoxia and hypercarbia. Depression of EEG is also seen in hypothermia. Second neurological assessment is evoked responses. Evoked responses. Neurological assessment type 2. Neurological assessment is of two types. One, it is done by EEG. Second, it is done by evoked responses. So evoked responses have four types. 1. Somatosensory response. 2. Motor response. 3. Visual response. 4. Brainstem response. Visual response has maximum effect. Visual response is maximally affected by inhalational and intravenous agents, whereas brainstem is not affected by inhalational and intravenous agents. So visual symptoms are maximally affected, or visual evoked responses. Visual evoked responses are maximally affected by the intravenous and inhalational agents, whereas brainstem is not affected by inhalational and intravenous agents. Summary. Neurological assessment is of two types. Electroencephalogram and evoked responses. Electroencephalogram, activation of electroencephalogram can be seen, or depression is seen. Activation of electroencephalogram shows more frequency and low amplitude waves, whereas depression of electroencephalogram shows low frequency and high amplitude waves. Now, activation of electroencephalogram is seen in whenever we give inhalational agents or IV agents in low doses in the presence of ketamine, nitrous oxide, early hypoxia and hypercarbia. Depression of electroencephalogram is seen in high doses of inhalational agents or IV agents when we give opioids, or late or severe hypoxia, hypercarbia and hypothermia, we see depression of EEG. Similarly, we have evoked responses. In the evoked responses are of four types. We have somatosensory evoked response, motor evoked response, visual evoked response and brainstem evoked response. Visual evoked response has maximum affected by the inhalational and IV agents, whereas brainstem responses are not affected by inhalational and intravenous agents.
thank you and thank you for watching.